Lee, thanks for joining me today. In the midst of all this craziness, what a world we're living in these days. How's it been for you?
Well, it's just been crazy. Back in the old days, I would spend, and by old days, I mean earlier this year, I'd stay home one day to work, and it'd feel a little bit odd, but yet I would take that time, block it out, and be able to be heads down on a big writing project or whatever. Never would have imagined that I could go a solid month working from home and have it actually be 12, 14-hour days lots of times. But it's been, it has been just a really challenging time, lots of changes, and yet it has been really, rewarding in its own way.
So the two questions I hear the most often are like the how and the when of when do we start easing slowly out of the crisis phase of what we're communicating and the messaging that we're putting out there into the world. What's your thought on that in terms of just like the when and the how? How do you even make that decision?
Well, I mean, we're in the process of it now because we're recognizing that it looks like we are on the downside of the slope, that there won't be, we won't be overwhelmed with COVID-19 patients, and that it is time that we can start to have some of those patients who were, deferred because of not being, they could be deferred for 8 weeks or so without it having a negative impact, that some of those are going to, we need to be able to reach out to some of those. So it's, it's going to be one of those, it depends things on a case by case basis. We have to communicate what the reality is. The reality is that there will be a certain group of patients that now are, able to be seen. And we need to do it in a way that's safe and is in keeping with the existing executive orders in each of the states in which we operate. And so we're also then in consultation with those governors as well to provide feedback and guidance. And they're looking to our infectious disease experts in helping to shape what the new guidelines and policies will be. But whether it's masking for everybody, both patients and staff, or whatever, we will need to make sure that we're communicating not only that, hey, it's safe, you can come back, but here are what the expectations are going to be. Here's how things will be different when you do come back.
Yeah, there's a lot to it, and maybe that's why this isn't such an easy call that we can all just, hey, let's all agree to do it the same way. There are so many different implications to this. It's not, like I said, it extends well beyond the typical strategic and tactical decisions that we have to make on a daily basis.
Well, I mean, I think there's some phrases that we're all getting familiar with, but I think out of some of the White House briefings, whether it's Dr. Birx or Fauci, some of them have said, all models are wrong, but some are useful. And so what we always have to do is adjust our plans. We have to make plans, because if you don't have plans, then you don't have a direction. But you have to be ready to adjust based on the new reality that we're seeing. And the reality is that reality is changing so much and so quickly. And so it does really highlight the importance of being nimble and being able to make those adjustments on the fly. And then that sets up a new set of options from which we need to choose.
So what about personally, how has having a virtual community out there to lean on, like, have you found yourself being in touch with folks who you've seen at a conference, at an HCIC or another conference? Are you finding ways to stay connected there?
Yeah, I mean, I think the reality is because we're not face-to-face with our colleagues at work so much, we look for those opportunities to make connections even outside of the workplace. And for those of us who are in the healthcare communications and marketing and online social media world, the great thing is that we make some of those first connections online. We get them reinforced when we get to face-to-face at a conference like HCIC or one of the conferences that we've held, or SHSMD or wherever. And so we, you know, now fall back on those opportunities when we recognize that we're, all socially distant. We can be social media connected, and using technology to bridge those gaps, and also to help us compare notes, because none of us have faced anything like this before, and so we are making our best estimate of what's the best path forward, and being able to check notes with colleagues who are going through some of the same things is just really essential.
I agree. It feels like it's just magnified during a time like this where we haven't had, I mean, there are conferences that were going to be happening this spring in person and now they're not. And
Right.
so it's even just magnified even more. So,
Yeah.
yeah.
Yeah, the reality is that normally you're face to face with people, and normally you're working an 8 or 10 hour day. Now it's more like a 12-hour day, but you're always on. You're always connected with, the way you're connecting with people at work is through technology, and so being able to sort of shift gears a little bit and reach out for somebody else's perspective from outside the organization is really, really helpful.
Well, man, Lee, stay safe and good luck. Keep up all the great work during these unpredictable times.
Thanks, Jared. I really appreciate the chance to talk with you today, and wish you and all the folks the best.